right. Hi, everybody. I think it's afternoon now, so I'm going to say good afternoon. Welcome to part two of our series of why education is critical to the success of your facility. I'm super excited that you're here. I'm Rachel West, but I'm going to do all that in just a minute because it always takes folks a couple of minutes to get sort of organized and in logged in. And hello, Jean. And I wanted to start today while we're getting people sort of in and settled and ready for this really um, lively conversation. I wanted to ask everybody, what's the temperature where you're at? Because I don't know about y'all. I am in Boston, just north of, and it feels like it's about 400 degrees outside. I'm melting. So what is our temperature? Where are we? We're in the 90s. Oh my goodness. What else? Where else are we? Where else are we temperaturing? I guess it's probably coolish in the buildings that we're in. So you'll see everybody that there is a chat feature on your screen. This is meant to be an engaging webinar. I certainly can and do talk about education all day, every day, and I love it. But I really want to make sure that you all are participating as much as you feel comfortable as well. So, okay, we've got some in the 80s. That's good. That's better. Oh my goodness, upper 90s. Yiperoonie. The melting. So please do, it's way more fun when I can actually see your face, but I'm imagining you all in the audience. So it's helpful to keep us going in that chat. Just a quick story while we're getting ready and people are putting in their temperature ranges ish. When I lived in New Mexico, anyone here from New Mexico or out in the Southwest where it is hot, 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 hot? I had young kids at the time, and somebody dropped a crayon in the driveway, and the very next day we came out and it was a pile of wax on the front driveway. It literally melted the crayon in the driveway. So now I'm in Boston where it's supposed to be cooler, but somehow it's not. It's so humid today. But makes the hair fluffier or something. All right, it's about three minutes after. At IntelliCare, we give everybody about 3 minutes to get organized and situated. Hi from Central Virginia. So we're going to get started because there's a lot I want to talk about today. And I have with me my colleague, Diana Campion, who's here with me. We're going to be talking about education and sort of all sorts of good stuff today. But before we do, a couple housekeeping things. This is a recorded webinar. So just in case, if you want to watch it again, stay tuned. There'll be an email that comes out later that you can rewatch it, share it with your friends. This is meant, again, to be an interactive experience. We want to hear your comments and your thoughts. There's actually going to be a couple of times when I'm going to ask and solicit your opinions on a few things. I want to hear what you're saying. That's super important to me. And then lastly, there will be opportunities for you to contact me or contact us. It's very easy. My name and my email, it's rwest@intellicare.com. I'll put that in the chat, or we can get that out to you. So if you have questions for me later, more things you want to talk about education, I'm delighted to talk about education all day, every day. All right. So while I'm talking, I'm just going to keep talking and introduce myself a little bit, and then I'll pass it over to Diana. But so I'm Rachel. I'm the director of education at IntelliCare and the director of IntelliEDU, which is our division of education at IntelliCare. I've been a nurse. I was counting this morning. I guess it's about 22 years now, which is awesome. I love being a nurse. I didn't love being a bedside nurse, it turns out. I was in the ICU, and I loved that for a while. I did, but I actually found really that my passion and specialty needed to be education. And so for the past 15 or so years, I've been in education in all different kinds of capacities, from community college, career technical education, to online and on ground, pre-licensure, post-licensure, second degree, postdoctoral certificates, like the whole gamut. As a clinical instructor, professor, and then I was a program director for a long time. I'm really trying to challenge the norm. Any of you who've ever been and worked in academia, you know that there's a lot of we've always done it this way, which is something that as my person will just not allow me to be like, okay with we're doing it this way just because we've always done it this way. That's always been just not okay. All right, so I that's enough about me. As I said, I mentioned that I live north of Boston. I got a young family, love them to pieces. But I'm joined with Diana, my newest wonderful colleague. Diana, would you give us a little introduction?
Sure. Hello and welcome, everyone. My name is Diana Campion. I am a nurse and nurse practitioner. I first started off my career in the medical ICU and then also did several years in emergency department and trauma. I am also an adult nurse practitioner. My clinical interests include preventative medicine, sleep, and mental health. From a professional standpoint, my interests with education, because I also have a background in education, is equipping nurses with the skills, the knowledge, and the tools they need to advance their career and their profession. So that's my passion with education. And I've also done some nurse writing.
Yeah, that's great. So you'll see if you ever head over to our articles, I'm sure you'll check out some of Diana's work. She's a wonderful writer, and we're so glad to have you now as the other member of my team, the education development nurse. We're like right and left hand here, which is great. All
Very
right.
happy to
So
be here.
again, welcome everybody. I'm so delighted you're here. As I mentioned before, I'm the director of education at IntelliEDU and at IntelliCare. IntelliEDU really just, if I can take a quick moment, we are driven to help people find the tools that they need. We know that, you know, when you finish school, whatever school that is, you're only really just beginning your journey as an educated person. That's just the beginning. And so we wanted to make and have set out to make and have made a pretty large library. We've published over 250 courses out there. They come and go and cycle in and out through our library of ANCC accredited continuing professional development that is not boring. That's our big challenge. We run into that a lot, and we'll talk about that a bit today. When we think education, and those of us who are educators on this call, maybe there are some here, that you're underfunded. You're usually the person who's tapped on the shoulder last, and people have this idea that whatever we're going to be doing is going to be boring and dull and uninteresting. And I think we need to challenge that. So IntelliEDU was born out of that. We also build bridges and so on between community partners, institutions of higher education, and our workforce, but also, just in general, because it's just good to be part of that big ecosystem. All right. So we also know that education is really, in my opinion, and it's not just my opinion, the literature bears this out as well, that education really is the cornerstone for fostering that confidence, competence, and knowledge, obviously, in our nursing workforce. As leaders, and we all are leaders, whether we have a leader title or not, it's up to us to help foster that in our staff and in our colleagues and in our friends and everywhere. But we have to be really aware that we're living in a challenging time. I'm not going to tell you anything you don't know here already, but I think you need to just maybe hear these things again because it's going to really set up some of the conversation we need to have. We know that nearly a third of all nurses are considering leaving their profession, and almost 20% are considering changing employers. Now, we did a couple of webinars previously about how to try to help retain staff through cultural changes, through systemic changes in the organization. But today we're going to think about, that staff turnover and that staff retention, although I don't really love that word, in terms of using education as a springboard to do that. We know also that those who were nearest to retirement during the pandemic left, and they took with them that absolutely irreplaceable experience that they have built over time. I'm never going to have 35 years of med surge experience because I've not been a med surge nurse for 35 years. However, um, so those people have left. So I have different experience, but that's okay. Um, so we know that on average, the age of practicing nurses has gone down by about 5 years. So this all together means that we have a younger workforce with less experience. And I think we might have some newer nurses on the call. We might have some experienced nurses on the call. Um, this is not meant to be disparaging at all, only to say that we see you. If there are new nurses on the call, we see you, we hear you, and we know that you're going to do amazing things in your career, however and wherever that leads you. So how do we, really help think about this slightly younger, less experienced just by lack of time workforce? Well, we know that, and I maybe we don't know that, so I'm going to tell you that there's a very predictable curve, confidence curve that happens as people leave school. And I'm going to, spoiler alert, I'm going to tell you it's the shape of a U. It goes straight down and then comes back up. And that takes about 2 years. So you leave as an expert student, you leave school as an expert student, you're feeling good. You learned a lot. You're a little scared. Yeah, you're a little scared. But you've learned a lot. And over time, you realize how little you really know because you're a new nurse. And right at that low point, that happens between 1.5 and 2.5 years for most people. You're at that low point, and that's where we're seeing right now that huge group of people saying, "I'm good. I'm out of here. This is terrible. I'm gone. Bye." Um, so if we know that that curve exists, and by the way, that curve happens every time you change jobs, change units, change specialties, change acuities. It's less severe, but that confidence curve happens at each one of those changes in job. So as leaders, as people who are helping others, we need to know that that curve exists so that we can do things and put things in place to help people sort of avoid that. And really, one of those best ways to do that is to build an infrastructure around continuous professional development. If we have any QAPI folks on the call right now, you know about quality assurance and process improvement and performance improvement. You're always looking at awesome metrics. I love the work that you do. It's so valuable, and I bet. Actually, you know what? I'm not gonna make an assumption. I'm gonna ask you all a question. What is the biggest pain point you're having with your staff right now? And I'm going to give you three options. You can pick whatever you want, but if you want to put in A, B, or C, A is lack of experience, B is lack of loyalty, and C is lack of support. What do you think are the biggest pain points today in your facilities or in your practice that you see? Lack of experience, lack of loyalty, or lack of support? What do you think? I'm going to wait for a couple minutes to see what we have in the chat pop in. So don't be shy. I promise I can't jump through the computer and bite you. Plus, it's Wednesday and I don't bite people on Wednesdays. So that's good news for everybody, too. All right. All right. So we got a couple of answers here. Um, Lack of support, lack of experience. That's great. Um, Okay. Yeah. Yeah. So it really is. I mean, there's no right or wrong answer here. Thank you so much, everybody, for putting stuff in the chat there. That's super helpful. I'm glad to have you answering here and thinking about this a little bit, right? Um, the real answer is it's all three. And there are three things that we can, should, and do need to address. So, all right. Very good. Um, All right, so we've been hearing a lot in the news about this idea that we have a nursing shortage, and I just told you that a third of people are leaving the profession, and 20% are changing jobs. Or we're going to have a lot of churn. But Diana, I'm interested in your perspectives. Do you think that there's a nursing shortage right now, or are we on the brink of one, or what do you think? I'm interested.
I do think that we are in a nursing shortage, and I think the big question in the nursing world is is it a matter of do we have enough nurses in the profession, but they've left the bedside due to the
Mhm.
conditions and the challenges that they're facing? Or do we have enough entry level nurses to make up for the baby boomers retiring and etc. And I think the answer is yes to both. I think we're at this critical juncture where we've lost a lot of nurses. That have a lot of knowledge, that have served as mentors, that have left the bedside. And we also have enough nurses, I think, that are now retiring due to being of retirement age. And we don't have enough nurses. I think we're starting at that point to really fill these spots.
Mhm.
And I think that makes it harder also because as new grads, they may not have experienced the same type of mentorship when they entered the profession that we had. And I think we need
Good
to be
point.
very sensitive to that. And I
Yeah.
think that's a way that education can also help bridge that a
Yeah.
little bit.
Yeah.
So I think the answer to that question, from what I'm seeing, is both. So
Yeah, I totally
we're at a critical time in nursing.
I think you're right. You're absolutely right. I'm really glad you brought up mentoring and preceptors. We actually know, and the literature bears this out too, that the stronger the preceptor program or trajectory or path, the stronger that is, the better outcomes we have in terms of lower turnover and quality of care provided. You know, if we're talking to a post acute care world in general, we know that how we document. I mean, I'm sure if there are educators on the call, and I'm going to ask you that in a minute, you can tell me that you probably spend a fair bit of time teaching people about ways to document to improve reimbursement, to improve, making sure because your reimbursement is completely tied to having enough people on the floor, having enough supplies in the building. So having that education tying into precepting people and then continuing professional development is really such an important piece. Those preceptors having a good curriculum for the preceptors. I've worked with, and I bet you have too, Diana, a variety of different places. When I was out at University of New Mexico, they had a preceptor program at the hospital that was attached to the School of Nursing. And in that program, the students would go through our program. And then many of them, because of just the landscape and universe of that area, many would go to UNM Hospital. And then they'd spend a year, 20 hours a week in classrooms. And then 20 to 30 hours, depending, it would change. But really, with this idea that they still had some classroom learning to do, as well
Mhm.
as a lot of very one-on-one specific precepting. And that's maybe an extreme of an example, but if you set out with the end in mind, you set out with knowing that you want to help people be fully functional nurses in your building. That starts from day one. That starts on orientation day and then
Mhm.
continues. Like, you don't just disappear after those first few minutes. So
And I think you brought up um, some very interesting points regarding how nursing or nurses as professionals should be supported throughout the course of their
mhm,
career. And
mhm,
I like to approach nursing education holistically the way we
mhm.
approach patient care.
Aha.
And it's also when we equip nurses, it's also about also equipping each nurse as a leader, as you pointed out, which I think
Mhm,
is extremely important. And for example, um, we have a lot of nurses that are specialized in geriatric nursing.
mhm,
Now, research has showed us that self care is imperative to nurse resiliency, but also maintaining and making sure education is accessible after
Mm,
nurses leave nursing school, and making
mhm,
sure that, they receive easily accessible education that they can easily manage into their busy schedules so
yeah,
that they are practicing at the top of their profession with
mm,
evidence-based care. And there was a research study done in 2018 that looked at nurses experiencing moral injury and burnout dealing with the geriatric population, because you have a population that is vulnerable due to age, decreased mobility, complex comorbidities, and
mhm,
then that puts a lot of stress on the nursing staff, especially if they haven't really been truly educated in Alzheimer's or dementia care.
mm,
So, what the
mhm,
study showed was by going through and providing refreshers and then also adding self
mm,
care, the
mm,
nurses were at less risk for developing emotional exhaustion, leading to moral
mm.
injury and burnout. So, I think that education throughout the nurse's career is pivotal. And you're right, it does not end as soon as we leave nursing school. And I think employers that recognize that become the competitive advantage, because
Absolutely.
when nurses go into a company, they want to invest their time with the company, they want to grow with the facility, they want to advance their career through that
Yeah,
facility. And
yeah.
by investing in education, that is investing in your nurses. And
You know what? No, no, go ahead, go ahead.
nurses are a loyal breed.
We
And when
are.
you support nurses and you see them and meet them where they're at, and
Yeah.
you help develop them in their career, I think a lot of problems that are happening in the workforce will decrease.
I totally agree with you. And I can almost hear the thought bubbles. I see a couple of nurse educators. Hi, yay, kindred spirits. Happy almost national continuing professional development week. It's coming up in what, like a week and a half, I think. We've got our own week. Woo! Here we are, professional developers. I love you. I love you all. Your point is really valid, and I bet I can see the thought bubbles. We have no budget. We have no resources. All I'm only one person. How many you're the only one in the building? Like
Yeah.
you're it. I'm lucky now. I've got Diana. But for a long time, and for most of the time, we're it, right? So how do we do more with less? We're always being asked to do more with less, and one of the ways that I would encourage you is to, and I'm going to stop talking, I promise, shortly. We're almost out of time. Do you believe it? Is to engage with your community. There are community colleges in your area that are looking for people to sit on the advisory board. If they're an accredited school of nursing, they have to have an advisory board full of community members just like you, to tell them what their nursing program needs. That has to happen, whether they're ACEN accredited, ANCC accredited, whoever they're accredited by. Thank you. They have to have these advisory boards. So engage with them. They'd be delighted. Anyone who raises their hand, like, yes, please come work with us. And I know you're strapped, and I know you have no budget. And I know whenever you walk around, people are like, oh, the education. Um, you know, it doesn't take a lot. I'm, as I said, happy to talk about this all the time. So please reach out to Diana or I. We put our emails in the chat. So I'm on LinkedIn. I know Diana's on LinkedIn. Find us there, find us via email, whatever you'd like to do, to reach out to us. But education doesn't have to be costly. There are a lot of resources out there that are low or no cost, that are evidence based. But one of the things that, we've tried to do at IntelliEDU is, keep the cost reasonable. We are starting to work with facility partners a bit. We're piloting at the moment for getting our education out there in a more systematic way, but that's not what this is about. You really want to think about, how can I build this, whatever it is that you're trying to build for that adult learner? They have to know why. Why am I doing this education? What does it matter to me? Like, how many times as a nurse, you got this mandatory training you've got to do, and you yourself, I've done it myself. All right, anyone who works at IntelliCare, just for a second, there's a mandatory training we have to do right now. And I did. I rolled my eyes and thought, oh my God. It doesn't have to be that way. Education can be interesting, engaging. We can put it in small snippets. We can leverage technology to help us support our learning objectives. We really can do all of that awesome stuff, and it's not that hard. I'm happy to talk about that. I want to give everybody a couple of minutes. We only have about 4 minutes left, but I want to give anybody who has maybe a burning question that they really want to have answered, the opportunity to answer that question. Or if there's, something that you've really just been working hard on that you're just stuck with. I want to give people an opportunity to ask those questions. Um, I've gotten a couple of questions, sort of in the chat here. There's a question that came in to us that we can see sort of behind the scenes about foreign nurse work. The foreign nurses who are working today, we have to think about our entire workforce, as a whole person. As Diana, you said, think about that big picture, that whole workforce, that whole person, and how their work in any given day is just one small piece. Even though it is 8 or 12 hours of their day, it's only one small piece of their life. I think this is a bigger conversation, definitely, than we have in the next couple of minutes. But I do think that we need to be aware. We need to be aware that there are in every practice setting, there is, not just practice setting, but every business type that exists. There are people that don't have the best interests of others at heart. And we have to be aware that that can and does happen. I would say that we need to educate ourselves about this phenomenon, and see, how we can, as individuals, really make a difference and impact in that. So I would encourage you all to check out some of the offerings that we have and have put together. Um, you know, Again, one of the things, we haven't talked too much about, so because this is not really about that, but our continuing professional development, we have a huge population of nurses that work for us. I think it's around 50,000 or so active nurses in about 30 states or something like that. Those numbers are approximate. We have issues that happen all the time, and maybe you have people that come to your facilities that come from us, and maybe you have an issue with them. We have a whole clinical quality assurance team of nurses who follow up on those complaints and issues that come through, and then we assign them. We built specific training just for when we have issues, that is timely, short, relevant to the topic. We looked at all the issues that came in and built. We now have about 75 mini modules available for retraining, that go out and people take them. And we actually, I've spoken at a couple of conferences. I have another one coming up this fall about the reduction in repeat complaints on those same issues, using that model of clinical nurse, just in time education for retraining, and the issue really goes away. I mean, it's remarkable. So if you happen to be coming to the Sigma conference later this year, I'll be there. I'll be delighted to chat with you about our findings on that. It's really been remarkable to see the improvement in quality of care. All right. So everyone's feeling shy today, and that's okay. I forgive you. I gotta go. Thank you for coming. We appreciate you. Thank you for all that you do. I'm Rachel West, and I'm here with Diana Campion, and we'll see you soon.